Hi, everyone. I'm Steve. I'm here with Dr. Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. If you watch the channel, you already know that. You can check out Biointegrated Health at online, and you can see all the different things they treat and the cool things they do. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
So we've been talking a little bit about, biohacking and peptides and all these molecules that give signals to the body, and it's pretty amazing. So, I mean, it I understand why people are so excited about it and researching them and, want to know more about it. But you wanted to talk about a category called bioregulators, right? Bioregulators. So what's a bioregulator?
Well, again, start with welcome everyone. Today we're talking about these wonderful, as you mentioned, bioregulators, one of the most misunderstood, misused, and oddly whispered about topics in anti-aging medicine. So you may have heard of them as described as Russian peptides, gene switches, cellular instructions, or my personal favorite, those things biohackers won't stop DMing me about because I get a lot of questions about this. And again, as a practitioner, our job is to not chase trends, but to understand what's coming and what patients are already using and what actually makes biological sense. And bioregulators are already in the real world, fortunately. And they're in concierge practices, elite longevity clinics, and definitely in the gym world. And yes, your patients are either taking them or our viewers here are thinking about them or even Googling them even late at night. So bioregulators are actually stored peptides. They're only 2 to 4 amino acids. There's tissue specific, so meaning there's thyroid. If you want thyroid, it's thyroid. It's for adrenal glands, adrenals. For blood vessels, blood vessels. They're designed to signal the cells to restore normal gene expression. So they do not force physiology. They remind cells that they can work on how they were used to working when they were younger. So it's not like, because peptides, they actually have a different mechanism. They act on the cell surface. But this one is a more intimate, intricate action with your DNA to tell it how to be expressed. Think of them like a sticky note left on a gene saying, hey, you used to express this better. Let's do that again. It's a reminder to bring them back to normalcy. And the originator of this is, again, in the Soviet Union, and it's actually gerontology research practitioners, and explaining that these are actually studied and there are actually medical literature to back it up.
So we want to get into what these do, these bioregulators, but first, we're kind of on thin ice here. You guys need to have a doctor that you can talk to because a lot of this stuff is for research only, right?
That's true. But the thing here is, it's in the market. You're going to hear it in your anti-aging realm or the biohacker world. That you're going to be hearing it about. It's you're fortunate. It's not prescription. You'd be surprised. We just definitely need guidance on this in terms of what condition you have, what type of bioregulator you should be using. So for now, not prescription. Peptides are, and we can define that later, but they are not prescription for the.
Yeah, and it's like need to not only will maybe talk to your doctor, but maybe 3 or 4 other doctors, and get there's so many opinions out there on this stuff. So be wise, be cautious, talk to experts. I'm not an expert. Dr. Nario does biointegrative medicine. He's an expert. So, I ask him a lot of stuff about a lot of things and other doctors too. So it's okay. I suggest you get opinions from medical professionals who are into this because some doctors are just into, this medicine does that. So you need to find the doctors that are researching this, don't you think?
Yeah, of course, especially now, as you mentioned, that there's some confusion between this and peptides. So this is important. That's not all peptides are bioregulators. So growth hormone peptides, they push output, they force it. GLP-1s modify appetite signaling. BPC 157 enhances repair. Bioregulators are different. They act at the nuclear level of the cell, influences transcription, meaning the process. So it's just letting an old cell go back to its normal function again. So it's not like forcing issues here like peptide. I mean, I'm not saying peptides are aggressive, but this is just bringing normalcy back. It also promotes tissue specific regeneration if the cell has the capacity to do it. It normalizes function rather than overstimulate it like our peptides. So again, analogy hormones, when you use hormones, you turn up the volume. Drugs, you override the system. Bioregulators, you're fixing the wiring. That's why they're interesting for aging because aging is fundamentally a loss of cellular communication. So it fixes the communication basically.
And that's what is so popular right now because peptides, they send a signal. They cause your body to give a signal to your body. So your body can't overproduce what it's signaling to produce because it's your body, right? And that's kind of what's fascinating and intriguing about these things. So that's the difference. I mean, you gave a great example of what the drugs do and all that stuff compared to what a signaling mechanism does. So give us an example of a bioregulator and something that's an example of one of these and what it's supposed to do so that people kind of understand an example.
Right. So there's so many of them, Steve, out there. Just to kind of name a few, but I'm going to highlight some of the main ones that are commonly used, like pineal gland. It's called epitalin. That's when you hear it. It's used to regulate circadian rhythms and telomeres. And then also for the
Epitalin,
immune,
so that's going to help you sleep.
right? Yep, that's correct. And then thymalin, which is also a regulator of the immune system, vascular tissue, vasogen. So there's you can see the name kind of already tells you what organ they're focusing on. And cartilage and joints, testogen, meaning gonadal signaling or testosterone, bronchogen, even for pulmonary tissue that's getting damaged. Again, not FDA approved. You have to remember, but these are really kind of like off the market ones that are commonly used by patients out there. And so I want to eyeball two specific ones here. So the one that I commonly encounter and actually backed up by studies would be epitalin. So that's the one that's for the pineal gland. And again, telomeres in the studies have been shown actually been lengthened or maintained, for example, and circadian rhythms are restored. Even longevity testing has been done on it and activates the telomerase enzyme, as we all know, that elongates your DNA strand. And again, improves melatonin, as I mentioned to you, and also lifespan of so studies. You have to remember, studies are still majority in animals, but there are suddenly now an influx of human observational studies, especially in Russia. So that's where it's coming from. The other one is thymalin. So that's number two. That's one of the more common ones that are well backed up by science. And the target is the thymus gland, which is responsible for the immune system, immune aging, immunosenescence, as we call it, as we get older. That's when it lowers down the function, makes us more prone to illnesses and diseases. And it restores the immune cells, like T cells, for example, and improves immune surveillance to find cancer or hidden infections, and also improves outcomes of chronic illness and even post surgical recovery. So it's very extensive and used a lot in the elderly and even hospitalized patients. So those two are the hot ones on the market.
Right, for bioregulators. Yeah. The whole, not the whole system, but it seems like a part of the system is really moving towards regulating the body and fixing the issues and getting your body to work like it's supposed to work or like it did when people were 18. Is that right?
Yeah. So what it does really is what we're, I mean, I'm not saying the younger population could not benefit from this, but aging, as we talk to our anti-agers out there, the aging as we age, genes again gets misregulated. That's why we get cancer. Genes cannot repair. Genes cannot turn on anymore. And that's why we call this the drift or the going away from normalcy. Bioregulators make sure that this epigenetic, the genetic, so we it's an epigenetic effect on the genes. It's like your maestro, right? Trying to fix the tones of the bass, the guitars, the strings. That's what it does. It's not changing anything at all. It's just regulating everything. That's why it's lowering down the genetic noise, restores youthful expression of patterns, and even organ specific signaling. So that's why this is something that we have to thank Dr. Vladimir Kavinson for, because he is the pioneer of this. I think he's the only one that's popping up in the spearheading of the popularity of bioregulators, and he's in St. Petersburg, and he actually named his institution the Bioregulation and Gerontology Institute. And this is where the majority of bioregulators are being made. So Russian made are I guess one of the better qualities to have. Yeah, but it's just hard to get that, especially now with our tariffs and everything, right? But again, we have to thank this guy to really like stepped up the plate to make this happen for us.
Yeah, it's amazing how a lot of these scientists and physicians are searching for ways to let's go to the root cause and make it work. And you look at even kids these days, 18-year-olds, 16-year-olds, way, way too many of them are fat and unhealthy. Way too many. And, we're talking about things that are FDA approved or not FDA approved. Let's see. Everything in our food is FDA approved, right?
I think so. Well, I hope so, because I went to Europe and they're saying that hey, the things that you have in your food, we don't have that over here. So we're doing
Yeah,
our double triple check on our ingredient lists here.
right, right. When people talk about the standard American diet, they're not giving us a compliment, are they?
Probably a wink and a little wink here and there. Maybe that's what we're getting.
Yeah, so I don't know. I'm always telling people to think for themselves, talk to your doctor, and then think for yourself,
Right.
in that order. So, but it's exciting time, and I think a lot of people are also thinking, you know what, I don't want to just disguise or cover up a symptom with a medication that, yeah, it works and you feel better, but is it really the best thing for your body? And are you really fixing anything? Right.
Right. Right. True. That's true.
So, do you have any last thoughts about these bioregulators? You talked about who's leading the charge in Russia and all that. Is there anything else that we should know? I mean, this is really cutting edge and it's new, right? Pretty new.
It is. It's breaking ground. I myself, I'm using it. I'm a big fan, just because of all the hype about it. It's just that studies. I go for studies, right? And human, and I have to admit, animal studies are there. And what do they prove? Immune markers gets better, reduce mortality in elderly population, improve endothelial and the blood vessel function, improve tissue repair, even genetic normalization. No massive randomized control trials yet, but again, can it be something reliable? Can it be something that be used safely? Low toxicity, low side effect profiles, and even very specific for tissues. I mean, there's even some studies saying that hey, you can try this for your diabetes. Use the pancreas bioregulator. Thyroid. There's one out there now that helps for thyroid conditions. Again, not medical advice, but this is just something to keep an eye out for in the future. And I'm sure many of you are on the bandwagon again. So we are, yeah, we're basically the lab rats of this generation to really see what's going on. But again, I'm not saying it's the safest thing ever. There are side effects to it, mostly GI problems, but really nothing major on the literature. But again, keep your eye out for it. Ask your doctor when you use these things, and it's always something that you want to put in your anti-aging back.
Sure. And a lot of doctors these days are keeping an open mind. And look, you hear people online and everything talking about these research molecules or peptides and talking about, doing research on their kangaroo. You know, I'm not going to play stupid like everybody else. Probably nobody is really doing research on their kangaroo. Do you think people are doing kangaroo research?
That's a good question. Kangaroo. Well, at least they're doing some research. Right?
Yeah.
At least it's
And
something.
they are their own kangaroo. I mean, let's not be dumb or stupid, right?
Right. Right.
All right. Well, Doc, as always, thank you. Thank you for your research, your real research. I know you don't do it on kangaroos, but I know you look at all the studies and everything.
The Aussies do that.
So we appreciate what you always bring to the table, and I'll give you one more chance. Any last thoughts?
Yeah. So again, you have to remember that these are not hormones. These are not medications. These are not medications, and these are, again, not regulated yet, but it's something that you have to make sure that you keep an eye out for in a good way, but also be safe on a good note. Because some people, I have seen patients taking this a lot, thinking that it's not going to harm them, but there
Which one are
are.
you talking about when you say this?
Oh, so a good example, as I mentioned to you, I see a lot of Epitalins and thymalin, right? So the dosing of this really are guided. So there are guidelines for this. Yeah, a good example for you. I have my thymalin here, and it's thymogen in the form. That's 250 micrograms, and they're dosed in micrograms. You have to remember. That's why they're very small in terms of dosing. But people just, I have somebody who takes it 4 times a day, 5 times a day. I just tell them, just keep an eye out for it. It's not something that you just want to pop in like TikToks. Always just be cautious. And again, if you're doing blood work, your doctor will do that for you if it's getting into the liver or the kidneys. But if you're taking it the right way, what, 2, 3 caps a day, that's fine. I think I've been taking it for a year and a half now, and I don't see anything that's really affecting blood work or any organs. But again, medical assistance is always needed when using all of these biohacking tools that we have in our pocket.
Right. All right. Well, thank you, Dr. Nario. Thanks for being with us.
All right, Steve, thank you so much. As we all know, knowledge is power, and thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.